Samuel Diaz III with Southwest Community Health Center, and I'm bringing you another video in our series around mental health awareness. Today I'm joined by Tara O'Neill. She's one of our clinicians at Southwest Community Health Center. We're going to be speaking to co-occurring disorders. Tara, thank you so much for joining us today.
My pleasure.
Such a pleasure. It's a beautiful day, so we're enjoying this weather. Can you give us a little bit more explanation about what a co-occurring disorder is? Other types of it?
Sure, thanks for having me. So co-occurring disorders are really just when a person has a substance use disorder diagnosis as well as a mental health or psychiatric diagnosis. Sometimes they're called dual diagnosis, dual disorders, or what I usually call is co-occurring conditions, because the disorder term can be kind of stigmatizing, right? So yeah, it's just when somebody has both the substance use and the mental health. And even though I'm kind of distinguishing between the two, substance abuse itself is a mental health condition, right? It's characterized as a brain disease, right? It's an illness.
Yeah.
And so with co-occurring conditions, they're really bidirectional. And what that means is that they influence each other, right? So if somebody is abusing substances, that can make the depression or anxiety or whatever their condition is, that can make it worse. It can also mask it, right? So if we're talking about treating it, it can be difficult to differentiate, like what's the substance symptom and what is the psychiatric symptom, right? And likewise, the mental health piece, sometimes people will self-medicate with substances.
Okay.
So it's really, they're intertwined, right? Like,
Got it.
it's hard to separate.
Nothing's ever black and white. There's always that gray space where they blend, and especially I think with behavioral health services, definitely blends.
Right.
Now, this past year, we've all dealt with a lot through the pandemic. You know, we've dealt with it in different ways. How do you think that has affected those who are dealing with substance abuse, or even those who may be in recovery?
Well, it's pretty significant. I mean, like you said, it's been a difficult year with so many different challenges, but I think it's even more magnified if you've got a substance use disorder or a mental health or both together. It's just more magnified, right? Like, so a lot of the coping skills we might normally have, the healthy coping skills, those have been more limited, right? Because we can't do all those recreational things.
Exactly.
We're socially isolated, which is also pretty dangerous if you think about substance use and using alone. If something were to happen, you're on your own. But it's been a difficult year, and the research is really proving that, right? It's catching up now. It's coming out now, showing us that especially opioid use, that's gone up. Overdose rates have gone up. You know, it's just so many of those stressors, even the financial stress that people are facing. So even if you had some recovery, or what people might call clean time, right? Your triggers have kind of gone off, you know, those things that might set you off. So it's been a difficult time, and people are pretty vulnerable. There are resources, but they're not always as accessible as they were before. That's one of the good things about telehealth, though, right? Being able to offer services over video or over the phone. Because sometimes it's just hard for people to just walk in the door, you know, so it takes that pressure off.
Yeah, no, that was going to be one of my questions next was, you know, what are some of the services that are available to someone who is in need? Because at different times in our life, we all are in need of some type of help or someone to speak to, or if we're dealing with a vice or some type of an abuse to our bodies, mentally, physically, we need that help. At Southwest, what are some things that are offered?
So we have a co-occurring program, and that's where I'm positioned.
Okay.
We offer a few different things. So it's all outpatient, which means you're not sleeping there. So we have intensive outpatient, which is 3 times a week, and it gives some more structure, a lot of education, and that opportunity to kind of get that emotional release and learn about the addiction and mental health piece. Then we have outpatient, which is maybe 1 time a week, could be every other week. And then we also have psychiatric medications and medication-assisted treatment. So like I said, with the opioid abuse going up, one of the big things and really what the gold standard of treatment is for opioid use disorder is medication-assisted treatment. So what that looks like is there's methadone clinics, right? We don't do that at Southwest, but that is one option in the community, and there's several. And at Southwest, we offer what is typically called Suboxone. That's the brand name. But it is a medication that gets rid of the cravings and withdrawal symptoms and really get somebody physically stable so that they can work on the rest.
Got it.
Right? Because you can't work on the mental health piece or any of the addictive behaviors if you're in withdrawal and craving the drug. It's just virtually impossible. So it's a wonderful thing. I'm really kind of honored to be a part of it and lead it. And so that's one thing I'd like to stress and get out there is that we do offer Suboxone treatment.
Excellent, excellent. And if someone's interested in services with Southwest Community Health Center, they can reach us by phone, right? 203-330-6000.
Yeah.
On our website, swchc.org, and as well as following us on social media at Southwest CHC. We could be located on Facebook, Instagram, and YouTube. Thank you so much for joining us today. We'll see you on the next one.